disorders of the gastrointestinal tract. Let's look at diarrhea. So diarrhea could be acute or chronic. Acute less than 2 weeks, chronic greater than 2 weeks. Acute diarrhea could be from infections, which could be viral, bacterial, and even protozoal. Viral as rotavirus, norovirus. Bacterial, for example, Salmonella species, Shigella, Campylobacter, Escherichia coli, also Vibrio cholera, and protozoal from Entamoeba histolytica as amoebiasis. It could also be drug-induced from penicillins. For chronic diarrhea, it could be from chronic infections like tuberculosis, also opportunistic infections with HIV and amoebiasis. And functional causes could be irritable bowel syndrome, among others. Inflammatory causes are ulcerative colitis and Crohn's disease, and could also result from malabsorption syndromes, for example, chronic pancreatitis, and malignancies like colon cancer. Could also be drug-induced from laxatives and NSAIDs as non-steroidal anti-inflammatory drugs, and it could be from endocrine causes like hyperthyroidism and diabetic autonomic neuropathy. Okay, so the main symptoms are frequent watery stools, blood or mucus in stool, presence of fever, reduced urine output, and it could be associated with vomiting too. And the main signs that could be elicited in adults are anemia, weight loss, anorexia, oral lesions like oral ulcers and candidiasis, and skin lesions like erythema nodosum. And there could also be signs of dehydration. That's the dry mucous membranes, reduction in skin tegel, and increased capillary refill time. That's greater than 2 seconds, and tachycardia, postural hypotension. Okay, so there could be enlarged thyroid too, and then abdominal masses and rectal mass. For children, the main signs are very sunken and dry eyes, and they could be restless, irritable, lethargic, even unconscious and floppy, and their mouth and tongue could be very dry, and they're usually thirsty, they drink eagerly, some of them drink poorly too. That's for severe cases, and the skin goes back slowly after pinching. That's reduction in skin tegel. Okay, so the main diagnostic clues for diarrhea are diarrhea with vomiting, low-grade fever with no mucus in stools. You consider a viral infection, and if the diarrhea is with vomiting, fever, abdominal cramps, blood and mucus in stools, then consider bacterial infection. And if the diarrhea is with blood and mucus in stool without fever, then consider amoebiasis caused by Entamoeba histolytica. And then if there is profuse diarrhea present as rice water stools with vomiting, then consider cholera. And if there is diarrhea with excessive vomiting, especially if in more than one member of the household or group, then consider food poisoning. And if the diarrhea presents with oral or skin lesions and weight loss, among others, over a long period of time, they consider HIV. And if the diarrhea alternates with constipation, especially in adults, then consider bowel malignancies. Okay, so investigations, FBC, that's full blood count, blood film for malaria parasites, stool routine examination, stool for culture and sensitivity, and blood urea and creatinine. So treatments, the main treatment objectives are to prevent dehydration, to replace lost fluid, to maintain nutrition by ensuring adequate dietary intake during illness, and to maintain personal hygiene, to eliminate infecting organisms where appropriate. So for non-pharmacological treatments, keep surroundings clean, improve personal hygiene, for example, hand washing after visiting the washroom, and adequate fluid intake, oral and intravenous as necessary. And also maintain adequate nutrition as can be tolerated. So for pharmacological treatments, it has to do with the cause of the diarrhea. So let's consider bacterial gastroenteritis. That's when there is fever, abdominal cramps, blood, and mucus stools. So the first line treatment, you give ciprofloxacin. That's in adults 500 milligrams 12 hourly for 5 days. In children of all age groups, you give 15 milligrams per kilogram 12 hourly for 5 days. For second line treatments, you could give cefuroxime IV, that's intravenous. That's 750 milligrams 8 hourly. 750 milligrams 8 hourly for adults. But in children, 25 milligrams per kilogram body weight 12 hourly. In neonates with age greater than 7 days, you give 25 milligrams per kilogram body weight 8 hourly. But for neonates less than 7 days, you give 25 milligrams per kilogram body weight 12 hourly. Okay, after that you give cefuroxime oral. So after the IV, you give the oral. In adults, 250 milligrams 12 hourly for 5 to 7 days, and in children 12 to 18 years, you give the same dosage, 250 milligrams 12 hourly for 5 to 7 days. Between 2 to 12 years, you give 50 milligrams per kilogram body weight for 5 to 7 days with a maximum dosage of 250 milligrams 12 hourly. And for 3 months to 2 years, you give 10 milligrams per kilogram body weight for 5 to 7 days with a maximum dosage of 150 milligrams 12 hourly. So suspension can only be given to children above 3 months. However, the IV can be given to neonates, and no antibiotics are required for suspected viral gastroenteritis. Adequate rehydration is the main requirement. Okay, so let's move on to amoebic dysentery. So when amoebic dysentery is suspected, that's when patient is failing to respond to empirical treatment for bacterial gastroenteritis within 2 days, or based on stool microscopy, and when there is diarrhea with blood and mucus in stool without fever, you give metronidazole. So metronidazole 800 milligrams 8 hourly for 5 days in adults, and for children from 8 to 12 years, you give 400 milligrams 8 hourly for 5 days. From 4 to 7 years, you give 200 milligrams 8 hourly for 5 days, and between 0 to 3 years, you give 100 milligrams 8 hourly for 5 days. So for cholera, that's profuse diarrhea with vomiting. Usually diarrhea is rice water stools. The first line treatment is tetracycline. So tetracycline, you give 500 milligrams 6 hourly for 3 days, but it's not recommended in children. Or you could give doxycycline oral. That's 100 milligrams 12 hourly for 3 days. And it's also not recommended in children, but You could also give erythromycin oral, that's 500 milligrams 8 orally for 5 days, but this is recommended in children too. For children above 13 years, you give 500 milligrams 8 orally for 5 days, and between 6 to 12 years, you give 250 to 500 milligrams 8 hourly for 5 days, and 2 to 6 years, you give 250 milligrams 6 hourly for 5 days. For 1 month to 3 years, you give 125 milligrams 6 hourly for 5 days. In neonates, 12.5 milligrams per kilogram body weight 6 hourly for 5 days. Okay, so zinc supplementation for diarrhea is not recommended. It's not required in adults, but in children, zinc supplement oral, you give 20 milligrams per day for 10 to 14 days in children with age greater than 6 months, but less than 6 months, you give 10 milligrams per day for 10 to 14 days. So referral criteria. So the main criteria is you refer patients who fail to improve or those who get worse despite therapy for acute diarrhea. You have to refer all patients with chronic diarrhea to a specialist for further evaluation and management.